Good morning, good afternoon, good evening from wherever you are viewing this episode of Getting to Zero, the series where I speak with public health leaders about what it will take to achieve a world with zero preventable diseases. If you are interested in knowing about our future conversations, be sure to like this video and also subscribe to our YouTube channel below. Today, my guest is Dr. Jarbas Barbosa, Director of PAHO, the Pan America Health Organization. Dr. Barbosa is a renowned public health professional with a stellar body of work in his home country, Brazil. Welcome, Dr. Barbosa. We are delighted that the Sabin Vaccine Institute and PAHO have such a strong partnership and that we have a unique opportunity to work together on what you have set as a priority for Latin America, the prevention of HPV and cervical cancer elimination. Thank you for joining me today.
Thank you for inviting me. The Sabin Institute is a very strong partner, and this kind of conversation about how we can get our children, adolescents vaccinated, I think that is a very important public health topic nowadays.
Thank you, Dr. Barbosa. So what made you embrace cervical cancer elimination, a top-of-line priority under your leadership of PAHO?
We relaunched last year the elimination initiative that is aiming to eliminate around 30 diseases by the year 2030. And the cervical cancer is one of them. Because for cervical cancer now we have the tools to eliminate. We have an excellent vaccine, and we have 48 countries and territories of the America that are already using the vaccine. We are only missing 3, Haiti, Cuba, and Venezuela. And we are working to have the vaccine available in these 3 countries until next year. Now we have 25 countries that have already adopted the one-dose regime. So now they have more vaccines, and they are expanding the use of vaccines. They are vaccinating boys. They are increasing the group ages that are being vaccinated. So I think that we can reach the goal to have 90% of the girls and adolescents vaccinated. Second, we have now a very good molecular test that can be used as a self-collection test, so the woman can collect the sample, so health community workers can distribute the collector and can get them after 1 day, 2 days. So this will save a woman that now they need to go 3-4 times to a health center to get the test. So we have this powerful tool, and we are working with the producers, the manufacturers, to reduce the price of this test. And third, we have also ablative treatments that can be performed at the primary health care level to provide the treatment for precancerous lesions that I think that is one of the very important problems that we have. So combining these 3 pillars, it's achievable to have cervical cancer eliminated, and I do believe that the Americas can be the first region in the world to eliminate and inspire other regions to follow us in the same way.
Very well said that the Americas can and must be the first region in the world to eliminate cervical cancer. Americas have done that in the past with other diseases, and there is no reason why they won't do it with cervical cancer and then really become an exemplar for the rest of the regions. So, Dr. Barbosa, you really touched on this opportunity that the single dose regimen presents, because you are using less vaccine and you can expand the supply, but also ease a lot of implementation challenges, which typically arise because of the follow-up issues. While advocating for the single dose for girls, you have also been a big proponent of gender-neutral HPV vaccination. Why, in your view, is it vital to also vaccinate boys?
It is really important. And we are encouraging our countries to move to the single-dose regime, but to keep the same volume of doses that they are purchasing every year. So they now can offer the vaccines to the boys. This will have at least two very important benefits. The first one is that we have sound evidence showing that vaccinating boys, we also are protecting the girls, because we are generating, I think, that herd immunity that is broader than only among girls. Second, let's remember that the HPV, the virus, is not only related to the cervical cancer, but also with other cancers, throat, penis, and other cancers that can be prevented. So we are benefiting the girls, and at the same time we are protecting these boys against other types of cancer.
That is correct. That while cervical cancer is a major public health challenge, there are also cancers among men that are induced by HPV, like, cancer of penis, anal cancer, neck, head, and really vaccinating boys can entail many of those benefits. Well, Dr. Barbosa, we've seen that most countries in Latin America are self-financing. Most of them do not depend on any kind of external aid from big global financing institutions like Gavi or Global Fund and others, and therefore, have to pay for their health programs from their domestic budgets. So how big do you think is the financing challenge in Latin America when it comes to adopting the three-pronged strategy for cervical cancer elimination that you just outlined, which entails, of course, primary prevention through vaccination, and you are talking about vaccinating both boys and girls, secondary prevention, through these screening tests where we have very sophisticated options becoming increasingly available, but also treatment of pre-cancer lesions, which is such an important dimension, apart from management of full-blown cervical cancer. Do you think there is political will to prioritize cervical cancer and also willingness to provide adequate financial and human resources?
Yes, this is a very important topic. First, we have in the Americas a unique mechanism that it can provide the access to high-quality vaccines by an affordable price. That is PAHO's revolving fund that has been working for more than 40 years now, and is crucial to guarantee that the countries using this regional pool procured mechanism can have access paying an affordable price for the new vaccines and very efficient vaccines like the HPV vaccine. So this is one very important thing that is unique to our region. Now other regions are trying to apply the lessons that we learn and are asking PAHO to support them in establishing similar mechanisms. We are working together with the Africa CDC, for instance, and also with the WHO EMRO region. Secondly, that we also have a regional fund, the strategic fund, that can offer laboratory diagnostic kits, health technologies to the countries. At this moment, we are negotiating with the manufacturers of the HPV molecular test, because now they cost around $25, $28 per test. And we really think that we can reduce this price to $7, around $7. So this will be, I think, that more accessible to many countries. Because many countries now, they are already developing, we are supporting them to develop a national plan to eliminate cervical cancer. And to guarantee access to these tests is a very important part, as well as to increase the vaccination, adopting strategies like vaccinating in schools, in malls, in places where the adolescents go. And we are also working with them to strengthen the primary health care, healthy workforce capacity to be a very important ally of this initiative to eliminate cervical cancer.
Fantastic. So I have rightly highlighted a very important issue, which is really the price or the cost of commodities. And I think the way you are leading this whole initiative to drive reductions in prices of diagnostic tests is really something for the rest of the world to look at. Because as you said, if a test that costs $20 can actually be made available to countries for $7, then that is what really gives them very high value for money that they invest in these programs. So you also rightly spoke about expanding delivery networks and actually bringing about some new innovations because we've seen that HPV vaccination is trying to reach a very new kind of an age group, right? So typically our vaccination has focused a lot on children, also on adults in some cases, but adolescents have never really been sort of a target of vaccination. So here, when we are talking about adolescents, we are looking, of course, at schools. But as you rightly said, the places that are frequented by adolescents. So what role do you think, Dr. Barbosa, the private sector can play in expanding delivery network? For example, at Sabin, we are now interrogating an idea whether drugstores run by trained pharmacists can actually be used as service delivery points for vaccination and diagnostics.
This is very important because, countries in our region that started offering HPV vaccine only in health centers, they are not achieving a very good coverage. Because adolescents in general, they don't go to health centers, and it's not easy for their mothers and fathers to bring them to a health center. On the other side, when we look at countries that adopt vaccination in schools, both public and private schools, they are reaching very good coverage. So I think that is important to go beyond that and to see malls, cinemas, theaters, so places where the adolescents go on weekends and to establish partnerships. And we have some good examples in our region about that. So the adolescents can have easier access to the vaccines. I think that this is really important if you want to get the 90% coverage that is needed to eliminate the HPV virus in this generation.
But I really want to understand from you, Dr. Barbosa, that is there any exciting opportunity to tap into the potential that the neighborhood drugstores and pharmacies offer, which are often run by trained pharmacists? Because I think this is something that can be transformative in many countries, which are constantly struggling with the paucity of health workforce. Because, if we are dependent on nurses and, doctors and for vaccination, but are not thinking of innovative ways of task shifting, would that not become a formidable barrier in some of the countries? Like, for example, you highlighted Haiti, right? Haiti, we have seen, has constantly grappled with many challenges, including the shortage of health workforce. So do you think that there are certain untapped resources such as pharmacies that can actually be used as we try and expand the network of delivery points? Now, for population in general, I mean adolescents, but also we are talking about elderly, vaccination and other services going forward.
You know that we have a variety of different laws and regulations among the countries in the Americas. In some countries, you can get the vaccine at a drugstore, a pharmacy like here in the US and Canada. In other countries in Latin America and the Caribbean, you can get some vaccines like flu. So each country has different laws and regulations. The general objective that we support the countries is that they need to find what are the best alternatives that they have to increase the access. So following their laws and regulations, how we can support them to increase the access. We are supporting the countries now to identify who are the population that are not getting vaccinated. So we are adopting this micro-planning strategy that has been fundamental to identify the pockets of non-vaccinated in the slums, in the big cities, in the rural areas. So many countries in our region now are recovering. In the Americas, we were the region that is showing the most rapid recovery from the negative impact provided by the pandemic. But I agree with you that every country needs to review what are the best alternatives that they have, because the main objective is to increase the access and to guarantee that vaccines will be delivered to the population with no out-of-pocket payment.
Right. So you rightly raised the issue of microplanning and really making sure that those populations that are marginalized, vulnerable, or excluded from the ambit of services really are becoming the center of all efforts and investments. One of the things, however, with HPV vaccination has been misperception and also misinformation and rumors and a growing hesitancy on the part of parents, that this vaccine could encourage promiscuity among adolescent girls. So there are many factors at play here which do not apply to childhood vaccines more generally. And one of the things that people have been talking about, therefore, is to actually link HPV vaccination with cervical cancer elimination and really offer the full suite of services as you are doing, right? Like you said, this vaccination is important, but if communities understand that vaccination is a part of a more holistic package, which also has diagnostics, but treatment, then they understand that we are trying to control and eventually eliminate a disease that is unnecessarily killing women. So what opportunities do you see in Americas to really embrace this integrated approach that brings together vaccination and HPV DNA screening, considering that our health systems have been rather siloed and fragmented? And what steps are you taking to provide pre-cancer treatment through ablation and really measure its provision and uptake? And I ask this question because when we started to dig deeper into data issues, we realized that there is practically no data available on treatment of pre-cancer. And it's therefore very hard to measure either the provision or the uptake of treatment services. And there is reluctance on the part of women to come for screening if they know there isn't a treatment pathway that is available to them.
Yes, I think that's very important to have the three pillars working together. So at the same time that you need to increase the vaccination, and I think that you mentioned a very important barrier, because unfortunately the HPV vaccine was targeted by some groups that presented these false narratives about the vaccines and the sexual activity. We have no evidence at all about that, but we have very good evidence now from Australia, from Scotland, that if you reach a good vaccination coverage, you can have a generation totally free of the human papilloma virus. So I think that this is important to strengthen the communication strategy, to listen the doubts, the questions from the families, and clearly state that this is a vaccine against cancer. This vaccine can save 40,000 deaths annually that you have in the Americas due to cervical cancer. And at the same time, to increase screening and treatment, I think that it's crucial to work with primary healthcare system. We are offering to the countries a comprehensive package. We are offering the test. We are offering the medical devices to perform the ablation and the training for the healthcare workers at the primary level. Because if they are not close to the communities, this can be a barrier. If a woman needs to take 2-3 buses to take one full day to go to a health center to get the test. So we need to facilitate the access. We need to reduce or eliminate barriers. So primary health care, I think that is the best answer, is to have the diagnostics and the treatment close to the communities. This is I think that key if we want to succeed in eliminating the cervical cancer.
Yeah, so you rightly emphasize the importance of education, awareness building, but also ensuring access to services and really close to the community, because if the services are too far away and there are several costs involved in accessing those services, we would typically see an impact on uptake. So Dr. Barbosa, you know that Sabin is working with youth, women, cancer and health networks to actually first form a global HPV consortium and now a regional HPV consortium to share best practices and information. Because as we have engaged with this subject more and more, we ourselves are very surprised by the low level of awareness that exists about cervical cancer and really the gaps in terms of information and knowledge. But how do you think how big you think is the need for building cervical cancer or HPV awareness and education in Americas? We see this a lot in Africa, as I said, and Asia, where surveys are showing, the awareness about cervical cancer is as low as 2% in many parts of many countries. But what is the situation in Americas when we talk about awareness?
This is a very important topic, Dr. Norada, because I think that if we have a public health initiative, and if we don't get all the stakeholders in the country, the medical association, the health workforce, but also the communities, the faith-based organizations, so I think that the private sector, so I think that we really need to build a very strong alliance, bringing all these sectors, all these actors. And the families and the communities, I think that is very important target. So we are supporting the countries to develop communication strategies, because I think that we need to send a very clear message to them. We have a cancer that is still, we have an acceptable number of deaths related to this cancer, 40,000 women dying every year in our region. We have the tools to eliminate this cancer. And so I think that this is a powerful message, but we need to share this, so the families and communities, they need to embrace this idea and to make this their own priority.
Wonderful. And Dr. Barbosa, as you go after this important priority, and I know it's so close to your heart, it's you have set a high ambition, but you're also bringing a great deal of passion, personal passion and commitment to this agenda. So as you take forward these efforts with countries in the region, what is it that gives you hope and optimism?
As a public health professional, I think that when we have a public health problem that is bringing suffering, death, that are leaving many families, poor families in our region in general, with a mother for the children, I think that, and we have the tools to eliminate this disease. I think that we have not only a strong public health perspective to do that, but also a moral and ethical mandate, let's say so. I think that this is feasible. This will reduce suffering for these families. This will be also a very important promoter of equality in Latin America and the Caribbean, because these 40,000 deaths, they are totally disproportionately affecting the poorest families in the region. So I think that is also a very important contribution from the health sector to reduce poverty, because when a family they lose the mother, they losing 50% of the poorest families in the Americas. They have only one woman as the adult that brings income to the family. So in this family, if they lose this woman, or if this woman needs to face a very painful treatment when they find out that she has cervical cancer. I think that if we have the tools like we have now, we need to act. And we need to act now. We need to act today. We cannot wait for tomorrow.
Thank you so much, Dr. Barbosa, for that message. We need to act. We need to act now. We need to act today. We can't postpone it till tomorrow because it is a moral and ethical imperative. Women are dying with huge emotional, social, economic costs. Yeah, it is a disease. Cervical cancer is a disease, first and foremost, of poor families and poor countries. And it is therefore an ethical imperative and also a public health imperative to make sure that we unleash the full potential of the wonderful tools and technologies that we have. We have the solution and we can absolutely resolve this public health challenge and save these women from dying. Globally, a woman dies of cervical cancer every 90 seconds. It doesn't have to be like that. Dr. Barbosa, thank you so much for your wonderful, wonderful, scintillating leadership. Really, being such a champion of elimination of cervical cancer in Americas. I'm sure you are going to inspire the rest of the world with what you are able to achieve in this region. And thank you for speaking to us today.
Thank you, Dr. Anurada, for inviting me. I think that's a very positive and constructive dialogue. And let's strengthen our partnership between the SEBI Institute, the Pan American Health Organization, and bring all the other stakeholders to participate in this very important initiative. We need to be the first region to eliminate cervical cancer.
Thank you. Thank you. We are sure you will be able to do it. We will be able to do it together. And it's a true joy to be working by your side, Dr. Barbosa. Thank you.
Thank you.